So just to let you know, our team has over 50 years combined experience in real estate, and we specialize in working with seniors. We also provide downsizing assistance for those needing extra help to make a move. And our seminar series was born because we saw firsthand that seniors needed helpful guidance and resources for later in life decisions. So we create and bring local service and experts to talk about important issues that we personally deal with as we age, as a caregiver or as an individual. A lot of you are caregivers still to maybe parents, maybe children, spouse, friends, and we just like to bring in helpful resources for you to get some additional knowledge and be aware of things. So real quick, we run from 10 to 11 or 11:15 with questions from our panelists, or questions from me. Our panelists hopefully will answer. At 11 or 11:15, we have open question and answer session. We have handouts for you to jot down any questions that pop into your head, so you can jot them down. You'll have them in front of you when we get to the question section. We have a no selling policy, so our panelists today are here to educate us in their respective fields, but they have brought information that will be available on your way out if you'd like to pick that up or talk to them personally afterwards. Notebooks, you'll notice that quite a few people have notebooks. If anybody doesn't have one, you get first-time attendee, we're happy to get you one. Just mark it on our sign-up sheet. And we ask that, again, that you always fill out an evaluation form. We like to get some feedback and hear your ideas for future topics. All right, so we're so glad you joined us today for our special seminar, Bringing Care to Your Door. And hopefully you're going to get valuable information that you can put into practice if you need to. So as we move through different stages of life, our needs and priorities shift, and making informed choices about daily living can have a huge impact on comfort, independence, peace of mind, and budget. And each of our speakers brings valuable insight, resources, practical tips that you can share with someone you care about. Alrighty, so without further ado, panelists, you want to come up and have a seat? And you'll need to flip your microphones on. Okay, great. So I'm going to start down here at the end. So if you guys would each tell us, a little introduction about yourself, your background, why you're here today. So Chiquita?
Hi guys, I'm Chiquita with Truly Treasured Home Care.
You got to hold it up maybe a little closer.
Can you guys hear me better? Yes. Sorry about that. I'm Chiquita with Truly Treasured Home Care. A little bit about my background is I worked in corporate America for about 15 years, working as a manager at a huge bank here in St. Louis and St. Charles, and working in management on developing people and developing staff. Prior to that, I was in health-related careers. Started off from high school as a caregiver myself, working in that industry, and then going into the hospital setting and working in that setting. Always had a passion for caring for people, and my mom used to always say we were going to own an agency together one day. And of course, as a child, you think your mom is just kind of talking out of her head, like, what are you talking about? Well, back in 2018, she passed, and in 2019, I found myself laid off of that corporate job that I had. And I went back to the drawing board and said, what should I do? And so home care came up because that was something my mom and I shared a passion for. And they say if you work in your purpose, you'll never work again. And that's where I am.
Awesome. Thank you, Chiquita.
Hi guys, I am Christina Lloyd. I am with Assistance Home Care. My background is I was a CNA at a skilled nursing facility right out the gate at 18. Total transparency here, I did not expect myself there at all. I actually was coaching gymnastics. A friend of mine was in nursing school. She said, "You need to come work with me." And I said, no. I'll do dietary. Let's do dietary. Sure enough, I was hired on the spot to be a CNA, and I flew from there. So I actually was at that facility for about 5 years, lo and behold, as a CNA. And then I moved and I was an activities director for an assisted living facility. And then I found home care. So I've always just kind of wanted more and more to be more of an educator for seniors, to know that there's options for them. It's not always maybe that skilled facility that you kind of always had envisioned, thinking that that's your only place to go. So here I am. I've now been here for almost 5 years, still educating.
That's awesome. So you've worn many hats and kind of worked your way up. So
Yes.
you have a lot of different perspectives and hands-on knowledge.
Yeah,
So
absolutely.
thanks for being here.
Of course.
Tom?
Good morning, everybody. My name is Tom Teasdale, and I am the Director of Transportation as well as a Healthcare Liaison with 360 Quality Care and Transport Services, located covering St. Louis, St. Charles County. As far as any background with me, I pretty much have a career that's been in account management as well as sales. And what really happened to me, how I ended up doing what I'm doing, is a couple of years back, both my parents passed away. And at the same time that happened, I had a job loss. And I kind of said, you know what? I'm 60 years old. I'm kind of done with just getting another sales job to have another sales job. I have a more altruistic viewpoint, having seen my parents go through what they went through. I said, there's got to be a way that I can help other seniors just kind of navigate the challenges of aging in place, or even from the transportation perspective, if you're in assisted, independent, skilled type of nursing, how do we help you be more mobile?
Okay, awesome. Thank you. All right, so let's talk about aging in place. Why is it becoming increasingly important in both national and our local context about aging in place? Why does it matter? Excuse me. So on the slide, we have some statistics. Sorry, we talked about this before. But by 2030, 20% of our U.S. residents will be 65 or more. So you guys agree with seeing more and more demand and need for your services? Okay. Nationally, 77% of adults 50 plus, really? That's awful young. But we want to age in place, and that's according to ARP. And I think in doing these seminars and talking with a lot of you, that's become very evident. Most people say, I do not want to go to X, Y, and Z. I love my home. I want to stay there and until I no longer can. So we're talking about support services today that can help you do that. So, and over 15% of our population in St. Charles County is 65 or older. So there's a growing demand, and we need valuable services. So, Chiquita, so broad stroke, can you give us an explanation or a definition of in-home care?
Sure. In-home care is a non-medical service that we provide clients inside their homes, or we also can go inside a facility to offer the service. Services that's offered are personal care, could be light housekeeping, like running errands, things that help make them comfortable at home so they're able to age in place.
Okay, so it's extra services, but they're non-medical. Is that?
That is correct.
Okay.
They are non-medical services.
Okay, great. I just wanted to I have to keep these things very black and white in my mind because these terms get interchanged a lot. So, all right, so non-medical. Okay, so let's break this down into a little bit more specifics. You started naming off some things. So, core services. Can you elaborate a little bit more on what those core services are that in-home care can help with someone in their home or a community if they're there?
Sure, I can take some, and maybe if I miss something, you can help me, Christina.
That's fine.
Okay, so we have like homemaking. That would be your light chore work, your light housekeeping. You have companionship. That would be someone is coming inside the home to help, do fun things together, or maybe knitting, or playing cards, those type of things. Let's see, you have medication reminders, of course, because we want to make sure that we're staying on course for what the doctor orders are. And so a caregiver can come inside the home to make sure that medication is taken on time, on schedule, and that is documented on what was taken.
Chiquita, can you guys hear her? You can? Okay.
And then transportation or errands. Transportation would be the service that we could come and help with to get you to a doctor's appointment, or that they could take you grocery shopping and walk down the aisle with you while you shop, to make sure you have assistance to get the bags back in the car, or to help you unload when you're back at home. I'm sure I missed some things. So.
No, you're okay. So the way that I kind of best summarize it is your day-to-day routine, right? It starts when you wake up, and it starts when you go to bed, if not when you wake up again. So anything that's involving that day-to-day routine, whether it's getting dressed, using the restroom, helping with your hygiene, getting you a hot meal for breakfast, because really, truly, what we often forget, especially how important that meal preparation is. So often than not, right? A lot of you folks, more than likely, used to cook for your entire family. Very often, almost every night, right? And now sometimes we're cooking for just ourselves, or we're cooking just for two. And it's really, really hard to kind of start figuring out what to make anymore. So nutrition is really important in your day-to-day routine, so we can do that meal preparation alongside of the grocery shopping, but also the transparency when it comes to that transportation is we're not kind of just as needed here and there, grab somebody to take you to your appointment. That's where we kind of refer out to tie you in a little bit later on, but not to throw you over on the side here.
He's going to be on this side for a little bit, so he'll get his time as well. So that's a lot of different services and areas, so that's awesome. So maybe it's easier to think about what home care is not, okay? Chiquita or Christina, you want to kind of hit that real quick? What home care is not?
Yeah, so I guess I can start off. So one thing that home care is not medical. So that means
Microphone, please.
I'm sorry,
Thank you.
it's not medical.
Not medical, okay.
Yes. So that means, what we mean by that is, it's not a service where we do IV injections, where we do wound care, where we do physical therapy. It's a service geared toward those things that we spoke of earlier. It's not a babysitting service. It's not like, hey, I'm calling you up because I need someone to babysit mom. That's not how it works. We actually put a care plan together on how to provide the best care for our clients.
Yeah, I think she said it really good. So I always tell a lot of people, think of it as more of a proactive approach rather than reactive. A lot of times we're also called for reactive. But, so like she's saying with the injections, right? We can't necessarily do the wound care, but we can be preventative for wound care. So we can put some cream and things like that to be on the preventative side, but once we are treating, that's where you now need a nurse. I hope that makes it a little bit more clear. And then kind of some fun facts that a lot of people often don't think about too, what we can't do, maybe by a show of hands. Does anybody think that home care, we can cut your nails? No, we cannot. And that's always something where people find it very silly. But because we don't know a lot of what we don't know, we can't cut nails and we can't cut hair. So there's just kind of a little fun fact for you.
Let me ask a question real quick. So if I'm using either of your services and it reaches a point where I have a bad wound or I need somebody to set my medications, if I bring an RN, I don't lose you,
No.
right? You bring an RN, you have people you can refer?
Each company is going to be different. So some of them have their own RNs on staff. Some of them we refer out. But we coincide with them and work together. The other thing that I often mention too, when it comes to medication fills, reach out to your pharmacy. Sometimes they will also pre-pill pack everything for you with timestamps on it, and sometimes at no extra cost. So whereas those RNs can get a little pricey, reach out to your pharmacy and see if they can support you with that too first.
Medicine Shop, I know, is one.
They are,
that
and they
normally does
deliver.
that. Yes, and they deliver. So just to clarify real quick, if I can. So Chiquita, you offer the in-home care.
Correct.
That's where the line is drawn. You can't step over to medical
That is
with your
correct.
organization. Okay. And then with assistance, okay, you guys offer that as well, but you also offer more medical.
Not necessarily.
No.
So we do have a couple RNs on staff.
Yes.
But they are mainly doing your medication fills. So we still can't do the wound care. And we still can't, like, we don't have the licensed physical therapist, occupational therapist, or speech therapist.
Sure.
So that's where all of that would go into your home health, and that's where insurance, you want to get that through insurance if you can.
So you guys have specifically, I know this is a question specific to your company, but you have RNs on staff that do medication.
They can, yes.
Okay.
So that's just part of the education portion, though, of doing research, because everybody has different niches of what they have to offer.
Okay, all right, very good then. Okay, all right, so let's talk about the benefits of home care to the client. So what are some of the things that the client enjoys and benefits from having the home care?
Okay, I'll start. Well, one is home care promotes independence. So again, most people want to stay, I can't say most people, but some people want to age in place or stay in their home, and they don't want to lose their independence. So agencies like ourselves or others, we're not there to take over or to make a client lose their independence. We're there to encourage their independence. So that's one benefit. Let's see, prevent hospitalizations. If you have someone inside the home, now we're helping hospitals lower that readmission rate by just having a presence inside the home. Even though we're not medical, we are still aware of certain signs of certain things that could be happening with the individual, and it's always good to have eyes inside the home.
And I think the best way to also support that would be just the advocacy portion of the role that we play as in home care. So it's advocating not only for you, for your children, for anybody involved. And so if there is that change in care, again, it's all rolling back to that proactiveness, right? Let's be proactive. We're starting to see a couple falls. Now let's start working with home care. Let's start doing and adding some of these things in collectively to be able to keep you safe. So that way, whether, like Chiquita was saying, wherever your home is, if it is your private residence that you've lived in for 20 years, if it's you're in an independent living facility and you don't want to make that next move to another apartment into an assisted living facility, then that's where we can come in too. So think about it all. I know, I'm sorry, I'm just repeating myself, but it's all about that proactive approach of what you're needing.
So I think in a nutshell, it can help people stay healthier, okay?
Yes.
It can keep costs down. It keeps people with, they're getting interaction, they're getting attention, and it's more of a normal routine. I know, you're in your own home, you've got, you still may have your pets, it's a familiar environment, and like you said, most of you all say, I'm never moving, they're gonna have to take me out feet first, but you might need some extra services to stay safe and comfortable there, right?
And I think too, sometimes having the home care coming in, it helps your kids be your kids, right? It helps you keep that relationship with your kids, because we all know that a lot of us are really stubborn, right? And our kids probably got that stubbornness from us, and so next thing you know, we have a lot of mixed emotions going into it as well.
Yeah, so that actually ties into our next slide, how home care helps the family, okay? So can you speak to some things that you see benefits to the family with having the in-home care?
I would say that it reduces the stress. It reduces caregiver burnout. I'll be honest, I was a family caregiver for my own parents, and as much as I hate to admit it, caregiver burnout is real. It's a feeling that no one wants to feel that, especially when you're taking care of someone you love. But it is good to partner with the agency that can come in and they can kind of be that relief for you, or they can provide you some respite care so you can step away and have some time to take a breath and, you know, and not feel like everything is on you. So I think that is something that we all in this industry stress to families, and that's why companies like us exist.
Yeah, I don't think I could have said that any better.
Do you find that maybe sometimes the clients will listen and do more that the in-home care person asks them to do versus a family member?
Absolutely.
Sometimes we are viewed as like we are the doctor, and we are not your doctor, but sometimes whatever we say goes. But I've had both experiences. I will say I've had both experiences. It depends. Everybody's unique, right? And so it's part of kind of reading the room almost, of knowing who we are. We are all individual. And I think that's what's so good and unique about home care too, is that we create a personal care plan for you as each individual human. It's going to be catered to you. And that's why home care is so important to have that one-on-one compared to just kind of being cookie cutter. It can't be a cookie cutter business or industry. Healthcare shouldn't be that way. And so it needs to be revolved around what is going to be best for you or your loved one.
Share a real life story on how the home care world really works for my parents. My mom had dementia. My dad was the primary caregiver. He wasn't a cook. He didn't really clean the house. Not his thing. But what my dad loved to do is he loved in retirement to go grab a cup of coffee with the 7 guys, called the Octo guys, octogenarians. So 8 of them would go sit at a bread co and have their coffees. My dad loved to play golf. He liked his Rotary clubs and all those things. Those are like kind of non-negotiables for him. But as my mom's health started declining, those became negotiable, right? And instead of him, he didn't want to be a burden on my sisters and me. He also just knew that he couldn't keep doing that. He had to take care of himself. So that's where he bought in home care. 4 hours a week, 3 days, 4 hours a day, 3 days a week, and took care of everything. Mom just did jigsaw puzzles and repeated the same story over and over again. And my dad just wanted to go have McDonald's and read his Newsweek, you know. So that's where it kind of goes. It just gives you times away. It gives you times to take a breath. You don't become a burden on your children, and a lot of things. So there's a lot of ways that it could work.
Yeah, that's a good story there, and I know that's very common, the caregiver burnout, and I know that quite a few of you in here are caregivers to loved ones currently. Prevents family conflict over the care responsibilities. So, you may not have sibling rivalry over, it's your turn, no, I went last, and all of that. You've got a professional to rely on. All right, when are key factors to consider in home care? Christina?
Yeah, I can take on that. So of course you have your hospitalization, right? That's usually when we're being reactive. Something happened, and now we know that we have to have this. But on the proactive side, we know that if there has been a couple falls, we need a little bit of that safety oversight. Maybe you need somebody to come to a home safety evaluation to see if we need to move some rugs, put some grab bars in, and then you have your cognition decline. The biggest piece of advice that I could probably give when coming to the cognition portion would be to start a little bit earlier. Let them get familiar with the idea of it. Let them get familiar with having somebody else to support. We kind of cling when we start losing some of our mind. We start to cling on to our loved ones, and it's going to make it increasingly harder and harder for you to feel like you can get out. And so starting that early with just a little bit of love, and then you can gradually increase that as you need to. But there's lots, we can go into that later, but there's lots of things that go into that too, just to keep your home safe. And then obviously your personal hygiene. A lot of times, I think those are probably the most often calls, is the personal hygiene, especially with dementia. We can't get mom in the shower anymore. She's only showering once a week. She should be showering every day, things like that. And so it's a lot of those areas too where we kind of want to add somebody in, and that's where they do sometimes tend to take on to one of us more so than not. And I think more than anything, what that boils down to is the dignity that we have. We don't want our kiddos to see us in all of our glory, right? And so having a stranger help you with that, it's a little bit less of that burden feeling. Makes it a little easier on them.
A couple other things we have specifically noted would be repeat calls for non-emergencies, weight loss, medication confusion, that's a pretty big one, depression, memory issues, isolation, hoarding, clutter, and then burned out family caregivers. So if somebody's been caregiving and they are completely burned out, and bring a professional in. So what if medical care becomes necessary too? So how do you guys coordinate when medical care actually needs to be brought in?
I think we kind of dabbled into it just a little bit, and that's where we would make the recommendation to talk to your primary care physician about getting an order potentially for the home health, or sometimes a rehabilitation stay. It kind of depends on each case-by-case scenario, or hospice. I know that that's a really scary word to hear, but it's not. And so it's, again, just all about that education piece on that quality of life. I've seen people come on and graduate off and go back on.
We had, was that last month we had hospice? Maybe 2 months ago, so.
Okay, so you guys
we
have
had a good, really good discussion about that too, so.
It is, and so a lot of it is just kind of picking away that ice chip. But yeah, so more importantly, when you're probably most going to be needing more than home care is those kinds of situations where you have your wound, you have your IV antibiotics, diabetes is a really, really hard one. So you just kind of have to really keep an eye on that and speak with your partnership of who's kind of supporting you guys on what they can and can't do. Do you want to kind of
And then also,
piggyback?
yeah, also, it really just depends on the agency you go with. Christina talked about how some agencies actually have home care and home health. But there's also agencies that partners with home health other agencies. So again, once you have the conversation and you're searching for home health providers, the agency that's there for the home care may be able to help you find a company that fits what you need.
So does the in-home care like totally go away, or you just add in addition to?
Yes, and that is for both home health or for hospice or potentially even rehab. I know for some of our clients we've supported while they're at rehab. Home health or hospice, they more so come into your home. And so now it's just, again, more so communicating all together as a whole, realizing that it is going to take all parties involved. It's just not one person that's going to say, this is what we're doing. It's talking about what those goals are and coming together. So we just start coordinating the care. A lot of people think when home health comes and now we're getting physical therapy on Tuesdays at 10 a.m., I don't need home care during that time. And you may not need it, but I will say it's also very empowering to remain and keep your schedule with your home care company to be there at that same time, because home health is going to want you to do your exercises every day, if not multiple times a day when they're not there. So what that does is now your care professional is going to know exactly how they're wanting you to do it, to help you with that encouragement, that motivation to keep doing it all day safely with somebody there as well for you. So it definitely goes hand in hand together.
The way I like to say it is, we create a village. So once you have one service in, that's your village, and then you expand your village onto other services if needed, but we all work in conjunction with one another for the good of the client's health.
So speaking of home health, okay, and these, again, why are they so close? It's like Medicare and Medicaid, everybody gets those confused.
I think they get confused very often because they're coming into your home. And a lot of times people think that home health is going to help you with all your day-to-day things too when you're there. But really, truly, they're probably only there for about an hour, a couple days a week. Occupational therapy, sometimes they'll help you with a shower. It just depends with what your needs are. But the best way, that's why a lot of times you'll hear Chiquita and I, and probably even Tom too, we refer to home care as private duty a lot. Because a lot of people do get us confused. And so private duty is a lot easier to separate than home care or home health, because they often just get merged together. But home health is going to be where a primary care physician has to sign off on it, and they have to follow you. So typically you're also gonna need a follow-up visit at your doctor's office within 30 days of that to see how you're making progression and progress on that. And that is going to be covered under your insurance. Whereas your private duty is all going to be private pay or sometimes covered through VA or long-term care. But that's the biggest separation. So basically private duty is, even though it might be needed, it's still a choice to have, if that makes sense. Whereas home health, your doctor's going to order it, tell you this is what you need to do, and keep proceeding from there. Do you wanna, is there anything else to kind of? Okay.
Yeah, I mean, the home care is all those things though that are still very important. I mean,
It is.
They're necessary, so.
It's just
I don't-
whether, yeah.
It's just how they
That's why I say by
classify them.
choice, because of you're choosing to provide that service for yourself, if that makes sense.
Yeah. So let's talk about the home care service providers. Let's talk about education and training. So what does that normally look like in the world of home care?
So education and training typically follow the same standards of the state of Missouri. So most agencies will require a certain hours of training that need to be met annually. That could be 10 hours up to 16 hours that will be needed. That could look like videos watching, on-hands training, or in-class training. A lot of caregivers also bring certifications that they've gained in their careers. And so if they come on with the agency, they help them to be able to keep those same certifications. And I think that is also how they place those caregivers with those clients. Based on the certifications and trainings that they have in their backgrounds, they'll know which client to partner them with.
Okay, so is there any formal training? Is there any like real requirement that somebody has been?
Not necessarily,
Okay.
yeah.
Yeah, that's one of the tricky things where, and I think we have another slide later on about this where we'll discuss it even further, but it's all about doing your research when it comes to home care because it is not state regulated, right? So whereas your facilities, they are going to be state regulated, okay? Home care is not. So therefore, the state does not come in and require and check all of our trainings off. It is a choice though for your home care provider of the level of expectations that they set for themselves. And I think that's very important to know and to ask when you're finding and researching about your home care companies, right? Because you could have, depending on your home care company, right? I mean, you could hire anybody, or you could make it your expectation that you hire somebody with a background of a CNA or a home health aide, of somebody that's been doing this for 3+ years. It just kind of depends on how their models represent, I guess you could say.
Okay. So what's can you give us any kind of typical, is it per hour range or cost-wise? for in-home?
For what the services cost?
Yes, yes, sir.
So typically the range, I would say $35 to $45 an hour.
And so this is the non-medical, right?
Yes.
Okay, all right, 35 to 45 an hour, okay. Okay, good to know.
So I think that's, again, part of that education of every home care company is going to be different. I've seen out in the field, there's companies out there that have 40 hours a week minimum. There's some of them that have a 4-hour shift minimum. There are, in going a little bit further in pricing, I mean, some of them will do overnight differentials, some of them will do weekend differentials. So everything is based on how and what it is. Some of them will base it on the skill set. And the skill set, going back to that, you can have anywhere from a companion to a nurse on staff, right? There's lots of different variables that it can go to. But if finances are on a fixed income, there are other resources. They are just a little bit slimmer. Transparency. There are services called CDS, which is Consumer Direct Services, and those are funded, I believe, please don't hold me to this, but I believe through Medicare and Medicaid, but there are a limited number of companies that provide that. And so that is basically where you would pick or know of an individual that you want to care for you, and the state would pay that individual, but where that goes hand in hand is the state picks how many hours of services they're going to give you, right? So if you feel like you're needing somebody there 8 hours a day, they might come back and just say you're getting maybe 10 hours a week. Okay, so just know that there's some other options out there too when it comes to that fixed.
Okay, all right. So real quick, we've got a slide up here that we've got it clearly divided. Like I said, I have to have this keep straight in my mind. So home care, non-medical support on the left-hand side, and on the right-hand side, home health, medical support, okay? So just kind of going over the differences. Home care is provided by caregivers, personal care aides, homemakers, family member. I guess that would be a family member on the CDS thing. Okay.
Yes, otherwise it would just be just a family caregiver
Right.
kind of volunteering their time for
Okay.
you.
Okay. So Christina, what is home health? What does that side look like? What are the services provided by?
That's kind of going to be your PT, your OT, your speech. It's going to be your wound care. Sometimes you can also get IV care with that. It's just going to depend. I've been seeing that less and less, and more so going back onto families to provide. And again, that's just kind of going to go back to where it's going to be paid for by your insurance.
Okay, so RNs, physical therapists, occupational therapists, speech therapists. Yep.
But also, just in my parents' experience, is then the home health would come in, they were there for an hour, and then they were gone. So if we didn't have a home private duty company in there, then my dad wouldn't have his respite, wouldn't be able to get away and do all the other things that he wanted to do. So they're totally different services,
Yeah.
long story short.
Yeah.
Okay. So focus on the home care. So those are things like supporting the activities of daily living to keep you more independent, preventing falls and accidents, companionship, we talked about that, helping with meals, errands, personal hygiene. Let's talk a little bit about the errands. How does home health help with errands? What does that look like?
They kind of don't. Sorry.
Okay.
Home health will not do your errands.
No, I'm sorry.
It's okay.
I meant home
Like very nicely they won't.
Home care. Yes.
Home care does. So again, doing your research, some of your home cares typically will do your errands and your transportations. And it's usually by choice of the client themselves if they are wanting to go with you or just send your care professional out on their own. And then that's where also sometimes transportation, like Tom could kind of tie into. So I guess, again, it's just going to be case by case scenario, and I'm trying to make this on just an educational standpoint without differentiating my company in general. But some of them will do it, some of them it's where they can only ride in a care professional's car, some of them will drive your personal car, some of them, if you have a wheelchair accessible van that you own, you can have your care professional drive that, or some of them won't do those, and that's where they would refer out again. So it is different, but yeah, you can send them, you can go with them to groceries, to doctor's appointments, have them sit in with mom and dad if you wanted them to take notes if you're not present. Doctor's appointments, I said that, where else? Haircuts, nail salons, we've done that. So again, just those activities, doing things like that, driving around, looking at the leaves and Christmas lights. It doesn't just have to be an errand of a chore. It can also just be going to sit at the park or drive around.
Lunch.
Yeah, lunch.
It could be something fun.
Okay.
It could be all of those things.
Okay, awesome. All right. Let's talk about payment. So home care, we touched on that a little bit. Private pay. How else can you help pay for home care?
So you have things like long-term care insurance that could help pay for the coverage. Some people do reverse mortgages to help pay for coverage or to help pay for the service. Credit cards, of course, will be an option.
VA. There are some companies that are VA contracted, and then there's also the VA aid and attendance. So that is where you would have to apply. And so that could be for you or your spouse under the VA aid and attendance, but transparency, it is a very long process. Just a helpful hint, if you are working with an attorney to do like your wills and your power of attorneys, some of them will also help you with that VA aid and attendance application. So I would take advantage of that if you can. And then long-term care, just a helpful hint if you have that. Knowing what your elimination period is. They are most on average a 30, 60, or 90-day elimination period. That means that you will still have to pay out of pocket for that amount of service days, not calendar days, before they start reimbursing you for those services. So just kind of something to have in your noggin.
Yeah, and I don't know how many people do have I have no idea. Does anybody have any idea about like the percentage of people that have long-term care policies? Or
I don't necessarily know an exact percentage on a factual standpoint, but I do know it's getting less.
I would think so.
The premiums are getting higher and higher because
Yep.
less and less people are paying into them.
So I'll just share, my mom has a long-term care policy. Then, so hers covers $250 a day, okay? Which sounds like, wow, $250 a day. That sounds, when I first started looking at that, I thought, wow, that's pretty good, Well, it doesn't cover everything, okay? So it's maybe, I think it's one of the better ones, but it's a pretty high amount, but $250 does not cover everything. She's in school care,
Okay.
but just thinking about $250 a day and in-home care per hour averages $30 a day.
Yeah, between 35 and 45.
Oh, 35, okay.
Yeah, an hour.
Okay, so really if somebody needs 24/7,
It definitely adds up, and every policy is so unique again. So it is just kind of sitting down with whoever you maybe have appointed as your power of attorney and making sure that they are also able to speak with your long-term care policy to gather this information, because it can be a lot and overwhelming. But everybody's is wrote out differently on how many it is per day or per month or per year, or you just get a lump sum right away. They usually either a doctor or they will have their own individual do an assessment on you as well to see if you even qualify for them to start paying out. So there's lots of different factors that go into that, but it is a payment option
Yeah.
for those who have paid into it.
sure. Yeah, I mean, you would want to use it when you need it.
Yeah,
for sure.
$250 a day, that's $7,500 a month.
Yeah,
And another thing too, right, again, if you have if let's say they are doing that $250 a day, think about that. I'm going back again to your proactive, right? If you have a 30, 60, or 90-day elimination period, it's a lot easier to pay for maybe 4 hours a couple days a week, even though it's going to take you longer to get to that elimination period. It's more feasible sometimes to pay that out of pocket compared to having now that hospitalization in that fall, and now the hospital is telling you have to have around-the-clock care. That's a very big difference of what you're paying out of pocket. So that's just my little nugget on that.
Which comes out to $90,000 a year. That's more than my wife makes.
It's a huge expense. That's the growing problem with all of us. So, communication portal. Do all companies kind of have a communication portal? Is that maybe a standard, or is that something unique to one of you guys?
I mean, as far as our agencies, I know, right?
Yeah.
Yes, we do, but I can't say for all.
Okay.
I think, I almost feel that it may be a bit of a luxury to be able to extend that to clients, to be able to give them real-time reports, real-time scheduling. They can see who's scheduled to care for their loved one. We have the family room portal where you can see interactions with the clients. But I can't say necessarily if every agency has that. It's not a requirement to have that.
So I would think I would want, if I was looking for a company to hire, I would want a company that does offer that, so I can have that accountability as the, family person helping.
And I know that on the slide there, we have the billing records and invoices. So some of those family room portals, you can turn it to where only certain family members have access to the billing and invoices. Not necessarily that everybody's got access to see the schedule and also the bills, right? So some of it can be a little bit tweaked on that too.
So it's a way of multiple family members also seeing what's going on. So I think that's
And a lot of family members don't live right here, right? So they're not local, so it makes it a lot extra peace of mind too.
All right, pricing. We talked about per hour pricing. So what are those based on? I mean, is it what type of service is being provided? Like, if somebody's just doing laundry and like housekeeping, is it one price? But if somebody's doing helping bathe, it's a higher price? How do you guys do that?
Really large question.
It really depends on the agency once again. I think some agencies will maybe give an itemized based on the services that's provided. Majority of the agencies that I am aware of, they do have an hourly rate regardless of what the care is or the service that they're providing.
Okay, so speaking specifically for both of your companies, if you have somebody doing it, it's based on the number of hours, not the specific task that they're doing. Is that right? Okay, all right. And so 24/7, is that something that somebody can get through home care through?
Yes.
Okay.
Yes, so through home care, you can get 24/7 round-the-clock care. There's also some agencies that offer what they call live-in care, meaning that an individual can come inside the home and live with the client. And that's sometimes a flat rate that they'll charge for that per day, because that caregiver will require sleep time. So of course they're not paid for while they're sleeping, so there's not an hourly charge on that. But now if you have a client where you must stay up around the clock,
Sure.
To supervise or provide care, that's probably where you need a person in there for a 12-hour shift or 8-hour shift to be able to cover that. So once again, it depends on the agency and the situation.
Okay, all right. So here we have some questions to ask, some screening questions, interviewing companies. So somebody, I think, already asked this. Can I be a client of your company regardless of weekly service hours, meaning there's no minimums?
Is that for us individually or as a whole?
You can answer it both ways.
So for me, the answer would be yes. You can be a client with no minimum. We do have a different price range depending on the amount of hours that you need. But if you need something less than industry standard of 4 hours or 6 hours or 8 hours, we can go lower to 3 to 1.
Okay, so there's industry standards of 4, 6, and 8. Okay, thank you for that. So another one here we have, do you conduct regular home visits? So that would be like a higher up coming in and checking. Do both of your companies offer that?
I do.
Yes.
Okay, is that an industry standard?
I don't think so.
I wish it was, but
Okay.
I just saying from my own background at being a family caregiver for mom and dad, I did not witness the agency that they were with coming in to do regular home visits, semi-annual, annual, quarterly. No.
Okay, all right, well, I mean, we've got it on here, and that was one of the things that you recommended that you asked for, and I think that's an important thing, so I'm glad to hear
I
both of your
definitely think it
organizations
is,
do.
because if your loved one, especially if they're living alone, right? And it's very easy for us to say that everything's going great when we do our phone call check-ins. And so those home visits are really, really great times to be able to see what's really going on and give that feedback to you of, we need to change the care plan a little bit. It's time to have a further meeting of maybe updating that or increasing care, or what are our long-term goals here?
So, real quick, what are some of the other questions to ask when interviewing companies?
Do they drug screen and background check their employees? And are you bonded and insured? That's a big one for me that I always tell everybody to ask.
Okay.
I agree. Also, what happens when you have a call off? Mom is at home by herself and she's expecting someone to be there to make dinner, and her caregiver is sick. Who's going to come in? Who's going to be able to help? Do we just go without care, or do we have a backup plan? That's very important question to ask.
So what if I talk to a care company and they tell me, oh, we charge $15 an hour? What would you think?
I would question who the caregiver is, because and what their background is, because that's kind of a red flag to me. Because if the agency is charging $15 an hour, what are they paying their caregiver to be able to provide the care?
Yes.
So,
Okay, yeah. That would be a definite red flag, right? You get what you pay for a lot of times.
That's it.
Okay.
Respectfully.
Yeah, okay. Couple other things, talking about, can I contact your agency 24/7, 365? That would be a great question. What are a couple other things?
I think a lot of people too sometimes assume that we are kind of the 911, wouldn't you say? So like, in a sense, if there is a fall, especially if they've hit in their head, 911 is still going to be called. At least, I'm sorry, it's hard to educate, but some people have that standard, because you do still want to get that checked out, right? And then you're also notified, like, how do you want us to proceed and things like that. So again, it all also goes back to, yes, we're your provider, but you guys are also going to know mom and dad the most and what those care goals are, and everybody needs to be looped in on that.
Okay. So, I know there's lots of questions to ask the vet. Insurance, I remember specifically we talked about that. Christina, you brought a point up about homeowners insurance, I think.
I did, yeah. Oh, at our meeting, yes. So a good, kind of little tidbit, nugget keep up there. So a lot of times people will hire an individual, right? We call that a private hire. So let's say you know your neighbor down the road has a niece who wants to come work and take care of mom, and now you're cutting her a check every week. If, say her name's Susie in this scenario, if Susie were to get injured at mom and dad's home, it is no longer going to be covered under your homeowner's insurance, because you are paying that individual as an employee for you. You are paying for a service. And so that is something to keep in mind, whereas with the agency of a home care company, if they were to fall, right? Like some people are using assisted devices that have wheels. If that were to roll over their foot, or wintertime, if they were to fall and slip on your sidewalk trying to get in because there's no ice meltdown, that's on us as an agency now to take care of those medical needs and not you as a family.
Yeah, okay, thank you for clarifying that.
Is there any legal line that it's whether they're getting paid or not paid?
To my understanding, it's paid or not paid. But I mean, you're more than welcome to consult with somebody, yes.
Okay. All right. Well, now we're going to switch to transportation. So I think Tom, will get to put you on the hot seat here. So more of these words. Non-emergency medical transportation. That's what we're going to talk about, right?
That is an industry, non-emergency medical transportation, NEMT, that exists. And it can be anything that is out there to help get somebody from their home, from a skilled community, from there, maybe back home on a hospital discharge or to a doctor's appointment, physical therapy, dentist, whatever. But it's helping people who can't drive themselves get to those particular locations. So, but NEMT is just kind of an industry buzzword.
Okay, so what are the benefits? What's the purpose of NEMT?
Purpose of NEMT really is to help anybody, doesn't have the ability to drive any longer, be able to get to where they need to be. All right? I guess you can even, because it says the word medical in it, so we're trying to keep you safe. We're trying to keep you healthy. If you say, I need to get to my doctor's appointment, but I don't drive, I just won't go to that doctor's appointment, well, that's going to impact your overall health. So that is where we want to be, is really somebody that if you have a chronic condition, a catastrophic and acute condition, you need to be able to get things to keep yourself healthy. That's where an NEMT company can come into play.
Okay, so does the transportation, do you need to be going to some type of care appointment, a doctor's appointment or something like that?
No, not necessarily. I mean, the scope of NEMT can include anything from the rideshare programs that are out there, the Uber Health, the Lyft Concierge, I think it's called. There's an Oats bus system out here that can do things like that as well. So there's options, and it doesn't necessarily need to be going to medical appointments. It's a specific company I work with is probably 99% is going to be something medical related. But if we've taken people from a skilled nursing rehab community to their son or daughter's wedding, yes. If we've taken people to the Christmas party, we've done those types of transports too. Now for us, the company I work for, we're primarily wheelchair and stretcher transportation. We do ambulatory. We'll probably talk about that a little bit more. But yeah, so a number of different ways that you can use NEMT.
Okay, thank you for that. So types of transport. So this is specific to your company and companies like you. So can you talk about the different, you just mentioned them, but a little bit more detail of what that looks like?
Yeah, overall, the NEMT space is pretty big. Overall, there's a lot of people in this world that covering St. Louis, covering St. Louis and St. Louis County, St. Charles County already. So there's a lot of, I guess, competitors for me that are out there. A lot of them have van accessible, vans that are van accessible. So, but with us, we do a lot of stretcher transportation as well as wheelchair transportation. And if you can see the slide, there's one off, the yellow one on the top right for you all. That's a stretcher alternative. It's super cushy and comfortable, and it can recline back just a little bit, so if somebody doesn't have really good core strength and you're afraid they're going to start sliding out of the wheelchair, we don't want that while we're driving them around, so that might be an option. Plus it can go completely flat or supine like a stretcher. Then it can be really comfortable for people with bad hips, bad knees.
Is that the Broda chair?
That's the Broda chair. Yeah, that's
Okay.
the Broda chair, and it can Yeah, we have, I think, 3 of those now, and we'll be buying more. It probably will replace stretchers eventually, or get close to replacing our stretchers. But yeah, super comfortable, great for long distance trips. We'll do those as well with our competitors. You know, we go to Chicago and Texas and Kansas City, areas like that.
Okay. So if you are a senior and you no longer drive, you know, something as simple as Lyft or Uber, but if you need to have, you're in a wheelchair or you need that personal assistance to get into the transport, is kind of the vein that we're looking at here, right?
As far as where, 360 comes in, yes. We talked a little bit that, we do ambulatory. This is one way to kind of look at it a little bit, that if you are on a rollator or on a walker, but you don't have a lot of leg strength, but you can still manage to get different places, maybe your spouse helps you get in and out of the car, that transfer from that walker into the car is one of the most dangerous parts of the entire transport. Because if that doesn't go right, somebody ends up on the ground, now how are you going to get back up? I know when I had to go try to help my mom get up, it was just screaming because I couldn't get her under the armpits. I really didn't have training on how to help mom get up. She didn't have the core strength to get up, and it's just become a hassle through there. But that's very dangerous. All right, so doing that. Now, you get somebody to the doctor's appointment, to the medical office building. They have their walker. You get it out of the trunk. You set it up. They need to walk in with their walker. Now you have a car. Maybe they have concierge service. Maybe they don't. You got to, while somebody's waiting, you got to go park the car, find a spot. Sometimes those are hard to find. Then you got to go meet your loved one in the lobby. Now you got to get up to the 5th floor on the very back part of the wing. By the time they get there, they're exhausted. So a lot of times the ambulatory that we'll do, will people say, you know what, it'd be much easier for 360 or an NEMT company to come here, put somebody in a wheelchair. Our vans are wheelchair equipped. Everybody has a transport wheelchair, and we can just wheel you up the back ramp, secure you in, drive you there. We can meet your loved one at the doctor's office, or we can bring the loved one in the van with us. And so that's great if you have a son or daughter that's going to meet you, and they're going to say, I got to go pick mom up. It's going to take an hour to get her into the car, an hour to get to the doctor's appointment, an hour for the encounter, an hour back, and I've lost half a day. I'd much rather pay $360 to do something like that, and I'll just meet mom at the doctor's appointment. And then our $360 will pick up and get mom back home. So.
Okay, so that's an example of the type of company that 360 is, and there's other companies out there, but they're specific to, they're catered to helping people that have difficulties.
Yeah, people who can't ambulate real well or aren't walking as strong as they used to.
Yeah.
Or I think to tie in too, sometimes we all might own a vehicle that sits lower or higher than what makes it easy to get in and out of too, right? And so sometimes because of the vehicle we own alone, it's just a safety feature that you need to use a transportation company.
You know, with my dad, he's 6'3", and he couldn't get into my car because his knees didn't bend real well. So anytime I had to take him somewhere, and it was a low rider too, so it was a challenge.
Okay, so Tom, what are some of the things, service type is something that you mentioned is very important to, when you are trying to arrange for transportation, some questions, specific questions to ask. So can you talk about curb to curb?
Yeah, so yeah, different companies, different business models, all go under the NEMT space, okay? So some of them will, when you call and you ask questions, it is, do you provide curb to curb service or door through door? Curb to curb will say, I'm not gonna go into your house. I'm going to sit at the curb, just like a taxi cab. You're going to come out and meet me. I'm going to drive you to the medical office building, and I'm going to drop you off at the curb. And good luck, find your way to the doctor's office, right? That's fine for me, but it may not be fine for where my dad was at that time, right? So that's curb to curb. They're just going to meet you, just like a taxi cab. You got to do a lot more of the ambulation. The door through door is a service to where the company will actually cross the threshold into your home, additional insurance to be able to do that. If you are in bed or you're in the lazy boy chair, can help get you into the wheelchair, wheel you out into the van, secure you, take you to the doctor's office, take you out, take you all the way up into the doctor's office, and drop you off. So it's door to door, or in a taxi cab, and door through door, curb to curb, sorry, and door through door is going to be more, we'll say, concierge type of service, more full service.
Right, so curb to curb that could be a regular Uber.
Yeah.
But that doesn't really support somebody that needs help. you know?
Right, so if somebody has a wheelchair, the Uber driver, you don't know what type of car, if they're gonna be able to put the wheelchair in the back or not, and what all the services, sometimes they'll show up and say, oh, nobody told me it was, a wheelchair transport, I don't do those. And they don't wanna help you get in and out of the car either, because just there's such a risk in doing anything like that, so, yeah.
Chiquita?
Can I also add how we also can work as home care providers in conjunction with transportation companies like Tom, because now we can all help with the door-to-door. So if there's an individual that maybe because of cost, they want to do the door-to-door, and they have a caregiver that can help prepare them to be ready for transportation, can help get them out, can follow them to the doctor's appointment, that may be able to kind of work in conjunction with one another.
I think a really good example for that, has anybody done the Day Institute program? Or know anybody that's done the Day Institute program? Okay, so for instance, that would be an example of like curb to curb, right? Because you have to be up, ready to go into their van. Okay. Examples are a little easier.
Yeah, so what are some of the other questions to ask when you're looking for transportation, non-medical transportation?
I would think that if you're calling around and you're looking for any sort of transportation in this space, is first of all, the state of Missouri, for what I do, is very unregulated. So the barriers for entry aren't real big. So somebody who maybe has a wheelchair van, been driving mom for a while, mom has since passed, and I still have this van, it's not hard for them to say, well, I'm just driving with other people, as well. So there is some background you just want to do, and trying to figure out who's reputable, it's tough. I was searching around Google, and it's like everybody I come across all has these wonderful stars, and I know that that's not necessarily the case. So, so it's hard to, if I call somebody and look at a website, it's going to say safe, reliable, and timely. Every single one of these websites is going to say the same thing over and over again. And you're calling, you start asking them questions. They, say, hey, are you on time? Well, of course we're on time. The thing is, they're not. And that's a hard thing really to determine, of who's reputable and who isn't. With us, I would personally say, how many vans do you have? Because my big concern is if you have one van show, 3-van show, and you have people covering St. Louis, and St. Charles County, well, you can have a van at Big Barns, you can have one at Mercy South and another one at DePaul. You don't have anybody in St. Charles. So how do you get somebody out here? If I'm at a doctor's appointment, I'm ready to go home. What's going to happen? You can be waiting.
Yeah, you're waiting. And so I have some stories, but, Columbia, I was calling saying, where are they? Where are they? I was with my dad at a medical appointment who's wheelchair bound. And the lady that was answering the phone for the transport service says, well, they're on their way. They're on their way. They're on their way from where?
Right.
Columbia, Missouri. I said, that's 100 miles away.
Yeah, so that's really tough. So I do think that, the size of the fleet does matter as far as being able to make sure that you're picked up. Maybe somebody have a 3-van fleet, but I only cover St. Charles County. Okay, well then that's just more questions to ask around there. But the ability to be picked up on time, to be picked up, because what last thing you want anybody to do is to miss a doctor's appointment. It took me 6 months to get to see this particular specialist, and my ride doesn't show up. That appointment's gone. And I'll probably be charged a fee because I didn't show up. And now it takes me another 6 months to go see that specialist again. all right, your health can start declining because of missed appointments that way. So it does have to do with, how long have you been doing this, how reputable, and it's hard to tell on a phone call who's going to be reputable. But, what happens if a van is out of service? Now my 3 vans is down to 2. One of my drivers called off. Now I gotta fill my day's schedule with 2 drivers instead of 3. And what happens as soon as I fall behind? I am gonna have, we'll say 15 passengers on this given day, which is an awful lot. And I fall behind because somebody isn't ready. I either leave that person because I got more rides, or I take that person, but the next 2 rides, because I'm behind, I just cancel them. So I'm back on schedule. And that type of stuff happens all the time. So that
Domino
is
effect.
volume over value. So it's, I'm trying not to sell here, but we don't do as many rides in any given day. Our drivers will be scheduled for 6 to 7, knowing by the end of the day, depending upon where they are, they might do an 8th or a 9th. But for the most part, it's going to be about 7 rides, so we can wait and do things the right way. We can do the door-through-door type of service rather than hurry up
Okay.
type of thing.
Stair navigation capabilities. So to what extent can transport companies help with that?
So I know out in St. Charles seems like there's a lot of 2-story homes. Seems to be, I don't know, the McKelvey or what. I don't know who it is. But there's plenty of 2-story homes out here. And with NEMT companies, I can't speak for all of them because I really don't know all of them. But for insurance purposes and such, if we can go into the home, but we only want to do 2 stairs. So if you have 2 stairs to get up into your home, that's great. If you need somebody to get from the 2nd floor down to the 1st floor, we're really calling in, the EMTs to be able to help get you down the stairs. They're trained better on how to do that than our people. It becomes a workers' comp risk for our drivers to try to, bounce somebody who weighs, 250 pounds down a set of stairs. So, gotta be careful.
The return trip pickup process.
Yeah, this one's a big one.
2 different methods, yeah.
So, some companies will be out there and they'll say, hey, when you're ready, give us a call. That's called a will call. We'll find a van in the area and we'll send it over. All right? Now with that, maybe a van just happens to be in the neighborhood. The other one, it could be down at Big Barns, you don't know. Or it could be in Columbia. And so they're sending the van. You can be waiting for 30 minutes, 40 minutes, an hour plus for the van. And if you're not feeling well already, you just want to get home and take a nap and have a warm dinner. So that's a good question to ask as you're vetting something. How am I going to get back? Is it, do I have to call and schedule it? Or when the appointment's over? Or a will call means that when the drop-off happens, we know just from experience, our KPIs, that this appointment or encounter is going to take an hour and 15 minutes, usually depending upon the time of day. Morning, they're more on time. They get pushed back as the day goes on. But we will show up at an hour and 15 minutes later, meet you in the doctor's office on the door-through-door, and get you back home that way. So it's already scheduled when we drop you off rather than you having to make the phone call.
All right, some other questions to ask. How can the trips be scheduled? Online or by phone?
Different companies, different ways. I think a lot of them, all of you should be able to call. All right, now we have normal business hours. You certainly can leave a message and somebody can call back. If you want to schedule something online, you can go online and fill out a booking form and send it over to the company as well. So that's as far as the scheduling goes. Are probably the 2 most common ways is make the phone call or go in and fill something out online. Advanced booking, I can see, is your next question. And with our company, we have 30 vans circling the area, so we can fit a lot of same-day transports in. May not be the time you want, but we can see, call, ask what you can do. But for the most part, companies are going to want 72 to 48 hours advance notice in order to get you on the schedule. The sooner you schedule it, if you know 2 months from now you're going to need a service, schedule it. You get your time slot, right? If you're working with somebody that's a lot smaller, at least you know you've got that time slot booked. But if you're going to wait, schedules are gonna start filling up, then you're gonna call, it can be tough.
If I'm the person that's being transported, do I need to have cash on me?
The preferred method of payment is probably gonna be credit card. I don't think anybody's going to show up without having payment figured out in advance. And they probably aren't gonna transfer and say, I'll give you the cash when you get here. We would still show up. But if you didn't give us the cash before we put you in the van, I don't think we're taking you anywhere. So, but you can do, at least with our company, you can do cash, check, exact cash, check, or credit card payment.
Okay. In cancellation policies, that would be another one to ask. What is the
Absolutely, different one for different people. You just wake up and say, I just don't want to go. All right, same day cancellation, we're going to charge you $60 for canceling, because we already have our driver scheduled. They're already booked for that particular time, and now that van's sitting idle and we still have to pay that driver. So it'll be a $60 cancellation for same day cancellations. If you called us, a day before or later, we'll cancel that, no problem. We can fill that time slot.
So I'm going to speak real quick to my experience with transport companies. So my father lives at a skilled care community and is 250 pounds, and he's in a wheelchair. Okay, he's on Medicaid. So when he has to go to the doctor, which we've had a lot of them recently, they cover that expense for the transport because it's medically necessary to have that type of transport. So we've been using transport companies like Tom's speaking of. So I've encountered all these different things. Here's the card, call us when you're ready. I'm like, it's going to take like 20 minutes, so, and they're like, just call us when you're ready, and it's 2 hours later before when we call, I don't know where they are. That one time I found out they were coming from Colombia, okay? Now, I have had the luxury of dealing with a really great company, and it was timely. The people were there, they were in uniforms, they brought my dad in, they introduced themselves. I mean, they were professionals. Some of my other experiences have been pulling up with music blasting, okay, talking on their cell phone, okay, throughout this, trying to help my dad get out of the building and whatnot, and never getting off their cell phone, okay? So, to me, extremely unprofessional, and you can tell that they're not trained in any way, shape, or form to really help somebody who can't, who's in a wheelchair, or if wheelchair would be better than a walker or something in that case.
Right. Yeah. The customer experience is huge. It should be for all the NEMT companies. You hear stories, the loud music, the cracked windshield, just a plain old white van with rust stains on it and fenders that don't match and smells like weed. I mean, it's just, you hear stories about things like that. And I said, it's not a heavily regulated industry. But for some, I know with the company I work with, the safety is huge. So we have cameras in our car that forward facing so we can see the traffic going on out there, rear facing so we can actually see the passenger and our driver. So we can see, and the software in the camera can tell if they're on their phone and see if they're distracted, and we can produce a safety score. So our drivers are incented to get the safety score as high as possible, and so we got like 97% on the safety score. So
one time the van that came, so I guess it's my dad being a heavier person, he has a larger wheelchair. They don't have vans that can take that wheelchair. It's a narrower ramp. So what that looked like was the guy said, I'm gonna need your help. Okay.
Yeah, and that should be part of the questioning of any dispatching company.
He's pushing the wheelchair, and I'm behind the attendant pushing him. So you get what you pay for, and that's my story. But we have really gone long, so I know there was probably more. We wanted to talk about the transportation, but I'm gonna want to at least be able to get questions in that folks have. What are,
The
Cost.
Yeah, cost is always a touchy issue. My ops people say, but the best thing is to call and to ask, because there's distance, there's a flat rate, and then there's the distance, just kind of like a taxi cab. But because we are specialized really in that wheelchair space, even on an ambulatory ride, it's still going to be kind of the same rate. But I'm just saying for an individual calling, you could find anything probably in the industry of, I'll say $60 to $150 per leg. So call and ask those questions. But
per leg?
Per leg, per,
What does that
per
mean?
direction.
Oh.
One way out,
Okay.
and
I'm
another
thinking
charge on the way
legs.
back.
And then I'm thinking, are you counting legs on like on a rollator or, okay.
How long have I been doing that? I have yet to have anybody raise that. That's funny.
I think the only thing they,
Pardon? Does insurance help cover?
All right, big question. So Medicaid, Medicare insurance, all right, Medicaid will cover any MT transportation. The state of Missouri is a non-choice state, which means you call this company, we're going to call them a broker, called MTM. And MTM will take the order, and then they have all these companies underneath, and they will give it to one of those companies, or they'll put it in their portal and the company will grab it.
That's why I've had all these different companies.
And you get company
Because
after
it's
company, and you
Medicaid.
get a wide disparity. We do MTM rides, we'll do Medicaid rides. Usually we use it to fill in gaps in our schedule. That's not how we make money every single day, is by doing MTM rides, but we do, or Medicaid rides. Medicare depends upon your insurance. Now my understanding is as prescription drugs go up in Medicare Part D, in order to make things, keep them affordable, some of those transportation discounts or availabilities have kind of gone away. So that's something you got to talk to your Medicare agent about.
Pat, you had a
Yes,
question?
please.
Yeah.
Christina, one time you mentioned that home care is not regulated. Tom, you mentioned something about transit. Why is that not regulated?
That is just a state of Missouri thing.
That's,
I can tell you state of Illinois is. State of Illinois is state regulated for home care. There's, New Jersey is, I believe New York is, California, I mean, there's tons of other states. So I don't have that answer, unfortunately.
In the short term,
Yes,
Absolutely.
100%. And I, if I had the choice, I would wish it was. And I think that it would help so much, and I think we're just a little behind.
So what does the average citizen do for legislators to get into regulating?
There's an organization called the Silver Hair
It is-
Legislature.
Yes, it is through Aging Ahead. If you've ever heard of them, that's.
I usually don't get
You-
it.
But there are a lot of things and petitions where we just need, again, to advocate for ourselves and for others.
it won't happen in Missouri. I can guarantee.
No. You can try, and so that would be a place for you to go if you want to get involved and help with that. There's a group that does that.
But yes, especially with the grain of America, there's more and more kind of franchise operations that are going to be showing up, getting into this space. Maybe they succeed, maybe they don't, but it's Missouri just isn't a heavily regulated state where others are. So hopefully people will get on board with, become accredited. NEMTAC is an industry that accredited companies that are following best practices. So that can be a question.
I guess one other note that I would like to add too is, with that being said, we know that hiring care into your home can be scary for anybody involved. Not only as the client, but as a family member. Check with your agency if you are hiring a company. They should allow you as a family if you wanted to put cameras in your home. They should be 100% okay with that, and if not, that's a little bit of a red flag to me.
Right, yeah.
But if that's going to help you give that peace of mind, or let's say it might just help you make sure the mom's not getting up in the middle of the night and trying to wonder, or something like that. But yes, you can most certainly put cameras into your home if you would like.
That's
Janine?
tricky though, because of their state of dress. Some
It
places
is.
will allow and some won't because of that.
Well, if it's your own home, you should be.
If it's your own home.
There's still a question on whether.
Some will not let you because they say that privacy thing. If you're not out there walking around naked, your parents don't want you.
Yes.
NASA? Okay.
And with, going back to the cameras really quick, I hate not saying that. As an agency, I would not have access to that camera, if that makes sense. For those privacy purposes, only you as a family would be able to view that footage. That, and that is for your personal. That's just kind of something yeah.
Diane, hold on. Diane.
You're talking about your will call, like if you drop your family member off at the doctor's office and your appointment is from, say, 1 to 2, so the person's gonna come back and pick you up at, close to 2 or whatever. What if you don't get into your doctor's office till 1:30, you don't get up to 2:30, say, not confident, me, say,
Well, what we do when we drop somebody off is we do give everybody a card, okay? And it will have on the back, the time that we're gonna come back, pick you up and say, hey, if you're running late, if you can call this number, we greatly appreciate it, because then our dispatch team can take that driver, send them somewhere else and find another driver and get them sent right over. So it's just kind of a courtesy thing at that. Or you need to run. Yeah, you can call, and then same thing with that. You can, if you say, hey, my doctor has me doing this, now he wants me to go over and have a blood test. And all of a sudden, now it's another 30 minutes, that happens, right? And just call, and we re-scramble or rearrange the vans on the road and pick you up still.
That's their company though. Okay, that huge, I've experienced it, so I can say.
It's all about the questions to ask.
Yeah. One more. Hmm?
You mentioned you can hire, you can, through an agency, you can get a personal care provider, like, my aunt is very ill.
The
My daughter's there
CDS.
all the time.
Yes.
And what is it?
It's called CDS, so Consumer Direct Services.
And can they be in place as well as palliative care or hospice care?
Yes, I believe so.
Believe
Because I believe they are billed differently. Double check with your social worker through your hospice company.
And it's a
C is in cat, D is in dog, S is in Sam. Consumer Direct Services.
Any other questions? Okay. Well, oh, sorry. Did you have your hand up? No, okay, all right. Well, sorry we went over, and sorry we kind of rushed through some of it. We never know how much time it's going to take. Real quick, our next month's seminar is going to be Sell Smart, Move Smart, Real Estate Decisions After 60, okay? There's information from all of our wonderful panelists up there. They'll be here for a little bit if you have specific questions for them. Sign up for our next seminar. And also, I had a special request to share information about, 5 acres and all of the discounted services they have for cats and dogs, neutering, spading, and that all comes from Miss Brenda in that neon yellow shirt. So if you want to get a pet chipped or want to know more about the services, she's a huge advocate for them. Talk to her. So these are great prices, by the way. Okay, one more. Go ahead.
Do any of your services provide help? A friend of mine used to work for St. Charles County, and she would help seniors pay bills and things like that.
I think that's going to be agency by agency. I can tell you that I would not. And the only reason why is because I wouldn't want there, God forbid, to be any misjudgment
Yeah.
or anything like that. That's where I would really advocate for a financial power of attorney.
Their companies, we actually had one in before. So we do have names if you are interested in that. But yeah, it's another whole level of integrity and
Right. Yeah, and unfortunately, it's probably also teeter-totters on that liability standpoint too.
all right, thank you guys. Can we get a round of applause for our wonderful panelists? Thank you, everybody. Thanks for your patience with us going over too.